I would like to know.
Oh, we should. But anyway, this is our favorite spinal workshop of the year. And we do it twice a year because this is the one where we really turn the workshop over to you, our patients, and ask you to talk about your experience with getting adjusted. Now, don't panic, Joan. It's not, no one's going to be called that they don't want to. So it's just strictly volunteer if you want to, share what's going on with you since you've been in chiropractic. And some of the questions that I like you to think about is not just how your pain level is or your physical body, but how your life might have changed by having your spine adjusted. So it can show up in many ways. So for some people, they had so much pain that they couldn't sleep at night, and now they can sleep at night. Or, they had so much discomfort that they were cranky all the time, and now they find themselves not, or better performance at the job. So there's so much more to chiropractic than just, I had low back pain and now it's gone. So we like to think about that, and we like to remember that really what we're talking about is the nervous system and the absolute incredible miracle that that nervous system is, how it lives in your body, and it is the only system in the body, the only system that is totally covered in bone. Can't get to it, right? The brain has the skull around it, and that spinal cord that's so delicate has spinal bones all the way down, covered by bones. Can't get to it. You get everywhere else, pancreas, stomach, everything. But we cannot get to that central nervous system because Mother Nature knew it was so important. It's important to your vitality, to your well-being. It's important to you staying alive. So as I've said many, many times, if that brain and nervous system were in your right leg, we would be right leg doctors. But because it's in your spine, we're considered spine doctors. But we're really, really nervous system doctors. And the nervous system is your key to your health, to your happiness, to your well-being in every way. So with that, I'm going to stop talking. But before I ask anyone to talk, I just want to introduce Lindsay. Sorry, I'm going to put you on the spot, Lindsay. This is her actual, probably 10th hour working for us. She's a new addition to our team. So please don't scare her in any way, shape, or form. Any way, shape, or form. And she's going to sit here and observe. So it's actually great. I think almost every time we've had a workshop, we've had a new team member starting.
Melissa too, yeah.
Right? Yeah, yeah. So, some people have been here 2 hours. Hello, sir.
Hello.
Dr. Kathy. What is your name?
Billy.
Hi, Billy.
Nice
So,
to meet
Billy
you.
just came 2 hours
Literally
ago,
started
okay?
a minute
So
ago.
don't scare him. And some of us have been here.
Well, let's see, who's here, if you've been here longer than 10 years, just raise your hand. All right.
Not you, Rachel?
I don't remember.
Close.
Longer?
No. Yeah.
15, longer than 15 years. Keep your hand up if you're,
I'm trying to think, wait, if your
About-
office in, on Fifth?
Yeah, on
yeah,
Fairview.
that's,
So that's
yeah,
over
that's
10.
15.
That's
Okay.
15.
Anybody here over 10 years? Anybody here over 5 years? Okay. Anybody here over 4 years? 3 years? 2
Probably
years?
Marie. Yeah.
1 year, Marie. Yeah.
That's correct.
Okay, so most of you are relatively new to our office in chiropractic, all right? Who here was referred by a family member? Family member. Okay, who was referred by a friend? How about a coworker? How about their directory? Okay, Bill.
How
All
about
right.
her to set a talk?
How about her set a talk?
Pat,
I
right?
heard you.
From the
That's right, yes.
Hillsdale,
Can
I
I
think,
just
right?
say how I got here?
Please.
I've been on the chiropractic care over 20 plus years. But my chiropractor got sick. And I heard you guys talking at our Fellowship Seniors Club more than once. And I didn't want to leave my doctor to come to you guys, but I wanted to come. And when he got sick, I said, I'm sorry, Doc, but I'm leaving. And that's how I started coming here. And I don't remember the years because I got under care for many, many years.
Mm-hmm.
And it helped me a lot.
I think you even came in to see us, right?
I
Just
did.
as like for a consultation.
kinda-
I'm not leaving my other doctor, but I wanted
just thought I'd
to.
see
You were
it.
getting the
So,
pathway
kinda get
ready,
the-
right? Just
I
in
told
case,
him.
preparing the road.
Yes, I was
Right.
waving it in, but I didn't want to just break because he was my friend.
Ah.
Now, who came from the internet? Who found us on the internet? Anyone here? Okay. All right. Good. Well, as most of you know, we talk about that thing, innate intelligence, a lot. And we know that from a chiropractic perspective, okay, because we deal with a triune, if you will, of health. And chiropractic is made up of both a science, which is the science of analyzing and detecting subluxation through our chiropractic means. And we study similar to medical doctors. The difference is that there comes a point in time where medicine goes on to study pharmaceuticals and pharmacology and physical therapy and all that other things, and surgical procedures. And we go on to study things like nutritional support, how to analyze the spine, how to locate and correct subluxations through chiropractic care. So that is the science and the art. The art is the adjustment. How do we adjust you? Okay. So much like the surgeon learning to do surgical procedures, we learn adjusting techniques, adjusting procedures. But the one difference that separates us majorly from any other field, healthcare provider, especially medicine, is that in chiropractic, and you hear us speak of it frequently, some of you more than others maybe, but we have a philosophy of life that there is in fact a universal intelligence. You know, as we've spoken to many of you over the short or long periods that you've been here, that there is that power that created us, didn't abandon us to turn into a toxic waste site, and that we have way too many body parts and we should just arbitrarily have them removed at various times throughout our life. And that health is, just a fleeting thing, that illness and sickness and poor health is something that we should have constantly. Although most of you, have any of you here tried that experiment that I suggested from time to time at workshops about going home and when the drug commercial comes on, to turn up the volume and close your eyes and just listen to it and don't watch it? Anybody take that challenge on yet? Okay, then I'm going to ask that all of you take that challenge on tonight. So when you go home, if you should happen to watch 5 minutes of television and a drug commercial comes on, rather than, I would hope you normally change the channel, turn the volume up on the drug commercial and close your eyes and just listen to it.
Oh, it's so terrible, you have to close eyes.
No, I want you to close your eyes, because I don't want you to
Suicide is
see,
almost
because
on every
I don't want you watching the dancing fairies and the lovely couple as they waltz across the floor prior to them telling you that one of the side effects is death.
You need to take something for the side effects that it
Yes.
gives you.
Exactly. If you happen to have opioid, constipation from all the opioid drugs that you're taking, we have a new drug for you. It's the latest. So, but nonetheless, that's why in our office specifically, we try to encourage people to listen to your bodies. Listen innately, which is what keeps your heart beating and your lungs breathing. We've had that conversation. And that's why we asked folks tonight to kind of get a sense of that. See, because for those of you who were able to come and or be here tonight, this is one of our very unique workshops in that it's not just about us teaching you how to better sleep, how to better exercise, how to lessen your stress, but we really want it to be an opportunity for you to, if you wish, no pressure, if you wish to share some of your experience of how innately chiropractic has kind of helped you at all. So, like that. See, because we forget about that thing called innate intelligence. We think that health has to come from outside in, when the reality is health comes from within us. So, with that, I will now stop. Because someone once told me being talked to death is a terrible death, so.
I like that. Can I borrow that?
Yes,
Okay,
of
good.
course.
She used it for days.
So Todd Meehan, tell us your story. Meehan, should I tell that? Tell us how you who sent you to us?
My doctor, actually. My
Was a
permanent
patient of
care
ours,
doctor
yep.
was a patient, sent me. I was having pain from my neck, shoulder, down my arm, to my hands for months, 6 months, 7 months. So a neurologist who said, because I had headaches too for that same amount of time, neurologist said, you're just one of the people who gets headaches.
It's normal for your
That,
age.
yeah, they did all the tests too. The tests were normal, which is great, but I was just one of those people. So I did physical therapy for months. That slowly got rid of the pain, and then it came back again. So, and then it just kept getting worse until I came to see both of you. Since I've seen both of you, the pain's gone. Have full feeling in my hands. Back has been great. I'm actually out with my son, teaching him how to ride a bike.
Who's
Never had
now
the
getting
energy
adjusted
before.
too,
And what about your son?
He's here getting adjusted now too, and he wants to see you on Thursday.
Oh,
But it's been great. I've had so much energy now since I came here.
And if I mean, I'm not divulging anything, but you've had some stress, right, since you've been coming in,
Oh, yes.
father and things like that, and
Yes.
you've come in and said, Dr. Kathy, this was such a stressful weekend, and I just have a little bit of discomfort, not as bad. So what would it have been like before you were getting adjusted when you have stress, right? Because that's a big thing that changes.
Well, before it was worse. Before I was taking, what was it, hydrocodone for the headaches and for the pain. Now I don't need any of that. And if it's really bad, maybe I'll take an Advil, but
Right.
that's about it. So.
That is so huge.
Yeah.
You didn't, those chemicals are so bad for your kidney and your liver, but once you get started on them, and that's just huge, because people are so, we know, Ivy, right? Hooked and addicted, and et cetera, et cetera. That's great,
fine.
thank you.
I
Tom.
find with adjusting and knowing your body heals itself because you and your nerves works with your body and your system. The doctors only know what you're saying. They didn't know what was wrong with your head. They were guessing. And I found this right here, H2O helps more than those cookies, no offense. And it keeps you full because I've been through a lot of stress. From bearing the 2 children 14 months apart, bearing my husband, my mom, my dad, and working full time. And I'm not a perfect person, but I can still walk in here and they look at me and say, you had a stress week, something out of order. Yes, I know it. I'll tell you. You get adjust, but your body heals itself.
The best doctor is right within you. Most
Yeah.
of you will tell me, oh, my leg is short, or this, right? And
Yeah.
you notice we don't ask you, how do you feel? It's not that we're being rude.
Can I-
We don't want to put you into the symptom mode. We want to see what your body's telling us objectively. If you lay down and say, you know, I've had a rough week, this is bothering me, we want to pay attention to that. But we want to be very objective and see where that spine is out of alignment and where it needs to go back in place.
If I may, can I ask anyone who has been, whether here long, short, or in between, when you first started, did you recall us starting by saying, tell me all of your symptoms before we do anything? Or did we ask you, let's first see what your body tells us?
Taya,
Yes.
tell everyone how you came to us and
Oh
how
my
long
God.
it took, right?
Yes, this lucky day I went to the church, so that's how I met, but I'm sorry for my English. So
You're
10 years
perfect.
ago, 10 or 12 years ago, first time I find out what the chiropractor was, I had terrible pain and my problem was hip and spine. I went to the emergency room and CAT scan and everything, and they diagnosed everything but nothing, the spine and hip. And the nurse stopped me and tell me, stop everything and go to chiropractor. I first time heard this word and I said, can you write down? I will remember this English
Where were
word.
you, Taya? Were you
I
here?
was down to Keyport, New Jersey,
Okay.
south, and I just translate this word in a computer. And okay, I made the phone call. I end up realize one of the best neighbor, but because I have a difficult communication because the language, it was chiropractor. So That's how in 6 months, no medication, and after third visit already, and I was in a point, I was losing the feeling in my leg. I was starting using age of like 20, almost 30 the cane because I couldn't use my right leg. In 6 months, everything was fixed so perfect. I didn't even had any pain or anything, but lately it's kind of started something. 2 years ago, I lost husband. That was the, he got age of 38 stroke, so it was terrible stress for me. And then I thought, well, I have to go to chiropractors. I have to go because I learned a lot of things there. And I hate medications. I never take even Tylenol. If I have a pain, I massage my head and that's it. So, and then when the other problem, which is it starts almost 5 years ago, I had this jaw problem and it locked my ear. I used to go to spend a lot of money to the ear doctor, and after visiting here, this is gone. I used to love to chew gum, and I stopped almost last 5 years, but now I'm comfortable chewing gum. Even if I just eat nuts or something, sometimes it's clogged and clogged my ear, and I end up going to the doctor again. That's gone. And I had sharp pain right in the chest area here, sometimes when I turn in the bed, and pain always was right here. After 6th or 7th visit, that's gone, and I don't have that. So it's like I had, I think this low back pain kind of a little bit getting, because I'm a caregiver, I had the lifting jobs. I studied totally different in my country. I came caregiver this country, so I was not that best professional, so I did some things wrong, hurt myself. So that's pain gone. I don't have a pain, and I had sharp pain right here sometimes when I was getting in a car, and I don't have that after 4th visit. And I was even marking a calendar in changes. So.
Oh, you had a lot going on.
Yeah, really.
Yes, because I play sport all my life, and with massage and this, I was kind of very close. I never believed the medications. And many times, I never broke my arms or legs, but twisted many times, and I had the pains or something, and I always believe the exercise and everything, it's better than take the medication. So I'm really thankful I went that church that day.
And Taya.
And I hope I will be
anyway,
one of
it
the
took like-
patient like after 10 years. like
Yeah.
I'm here.
Well, it took you like 6 months to get here, right? 'Cause or 3 months way to handle something.
Yes,
but you
like I couldn't
remembered, yeah.
come right away.
Right,
Yes.
right. So,
Yes,
yeah.
we
So,
start
I mean,
like
it sounds
New
like
Year's.
with those symptoms, obviously it changes your ability to work, right? And take care of the woman you take care of,
It
you
is
know?
it is a stress, especially I don't feel end of the day I don't feel tired.
Mm,
That's a huge change.
that's a big thing.
Yeah, because
Yeah.
having family there and even here, even doesn't matter how comfortable you're in work, it's a busy day. I'm doing a lot of things, and sometimes I was just like, oh, before
No
I went to-
energy,
that's
right.
gone. So that's how I'm really, yeah, it's really, even like sometimes when I come and I was telling Carlene, I said, wait now, they will find exactly the spot. Sometimes you have something they never miss. I said, just wait,
Your
what I
body
was
tells us.
saying.
Your body tells
So
us.
I'm really happy knowing what's the chiropractic means. So, glad to be here.
All right, you keep looking
All
at
right,
me, so it's my turn. I see it. I knew they were gonna come after me. That's why you made me come. Okay, fine. No, I'm just kidding. Oh, please. Please, get out. Well, to be honest, I was exposed to chiropractic as a young child. My father literally got off the train station, walked across the street because he had back pain, and saw another chiropractor. So on and off over the years, we went with my dad. The guy moved to another area, then his son took over, you know, on and off. I wouldn't say that I went every week or every month. Teenager, I'm not going, you know, those kind of. But I became an x-ray technician, and one day I put my back out. I don't know, I forget what I lifted. I did something stupid. And the doctor that was there gave me an injection into my back. Didn't help a bit. I still look like a pretzel. I was walking like the letter L. And I'm the only driver in my home. My husband doesn't drive, and I drive a clutch. So it's not like I can say, take my car. So now I'm sitting there trying to clutch, and I go past the guy that I usually go to. He's on vacation. No covering physician. I was like, "Ugh." And I went to 3 other places that day and stopped in. One person told me they couldn't see me because I didn't have x-rays with me. The other 2 said that they didn't have time because I wasn't their patient and I had to fill out all these forms, and I'm like, forget it. So as I got back in the car, my husband says to me, he goes, you know, there's this guy that your old chiropractor brought in one day to get a pressure washer. I'm like, what are you talking about? In pain, what are you talking about? We're going to the emergency room. He goes, no, try this guy. So I ended up at Dr. Jett's office. When he was down the road in Westwood.
You didn't tell me there were 3,
Yeah, they were that day, I was like, that moment,
I remember.
and then so I walked in. He didn't even, I filled out some papers and that was it. He got me on the table. He adjusted me. I would say that when I left. We're good. I can do this by myself. Yay. I don't have to come back. But when that started to fall off, I can tell you then, I gained a lot more weight. I became a diabetic, high blood pressure, cholesterol issues, and I came just before I had the surgery, right?
Yes.
And I had already slated to have a stomach sleeve where they take out 3/4 of your stomach. And don't you dare! And then they yelled at me for everything because I had a gallbladder out since I had seen them. I was working on the stomach. I think
And the
ankles. And the ankles. Yeah. Well,
ankle
that's something I don't think anybody could have dealt with. Those were shredded
I'm just saying
from a
those
little
were things
girl.
that had all happened
Yeah.
while you were.
I've had 9 surgeries between both legs.
I just had some challenges.
Just a few. And then on top of it all, thank God I'm getting adjusted now because unfortunately my brother-in-law passed in last July, and he used to work with my husband in our lawnmower shop. So guess who's working behind the counter now? And guess who's doing pickup and deliveries?
It's
So
amazing that you can do those things,
Yes.
though, right, Ivy? I mean,
Between
it's such a
the
huge change when you came back to
Yeah.
us. It's like you have a new life,
Yeah,
really,
between, I do have to say the surgery
because you
for
lost a
me
lot of
was
weight.
where I lost 140 pounds. So now my diabetes is just something sort of being maintained and watched. I'm not taking any injections or drugs, and all the other things have also subsided. But again, that's the combination, I think, because I had the surgery, I started coming back here, getting adjusted, feeling healthier, and now I'm up and about. The other day I was up and downstairs.
Mm-hmm.
I came here a week after I got smacked in the face with a trailer. Oh. The trailer hitch.
Well, what happens is then you know when you're subluxated, you know that you
Oh,
did
yeah.
something wrong.
Absolutely.
You know
If I
you missed
hadn't
the step.
been
Whereas
following,
before,
I would have been like, oh well, it's
Yeah.
just a stiff neck. I'm fine.
Yeah.
A little
Yeah.
heat, I'll be good.
You've made a huge change, Ivy. Like in your whole lifestyle. As you feel
Yeah.
better, your lifestyle changes.
It
So
does.
it goes hand in hand.
It does, because the pains, like the neck pains and the arm pains and even the arthritis pains
Mm-hmm.
are subsiding so greatly. And there's a family history of rheumatoid arthritis at ages of 20. So I got lucky.
To let all that go and remember the power of the body is always wanting to heal, always, instead of focusing on what's not working.
I just remember when I first came to and after X-ray, supposed to see the X-ray, I thought, I hope this is not my neck. Because
So I was sitting up
even
there
when
on
I
you.
didn't know anything how it's supposed, I knew something wrong that neck. And I even asked.
I'm sure there's no one
I
else
even
here.
asked,
knows
like,
that.
it wouldn't break, isn't it? She said, no, don't worry, it wouldn't break. It was like scary, it was like this.
Oh, yeah.
The shape.
There was no
yeah.
shape left there.
Mm.
It was bad.
Needs the shape.
Yeah.
Well, it's
Gloria,
interesting too.
talk to me. How are you?
Fine.
Smiling today. Gloria came, what, maybe 10 days ago? Not even? What happened? You were in a lot of pain, right?
Yes, I fell down the stairs. Like I missed one step and I went down my butt, like all the way down. And yeah, I had a lot of pain. And I came here because my brother came too. He had a really bad back issues, and he came here and you guys fixed him, and he never came back.
Yeah, that's not the story we want to tell.
Yeah, so he said.
But he knew what to tell you, right?
Yes, yes. I live in New York and Rockland, so I drive here because I just love it, and I feel I'm getting better. I sleep, I can get on my bed and get out, get up.
And you've maybe been here 5 or 6 times, right?
Yes,
Yeah.
I'm so blessed. Yes, thank
So
you.
great. And well, it's just not, we're just grateful to have every one of you. And it's not even, we never even like to think that we get people out of pain. It's kind of like this, the whiteboard Sammy had up, it's like going to Starbucks and just getting a plain coffee, right? There's so much more value in getting adjusted than just getting out of pain. But when it's something like Gloria has, you need to get out of pain because you can't even function, right? Pain is the great equalizer, and it just makes us do something finally, because like falling down the steps like that, we've probably all done that and maybe not hurt ourselves, or just, maybe took an Advil or something, right? And, we used to, when you were little, we used to sit at the top of the steps in our house and go all the way down on our butt, right? If you've got kids, you see them do it, and even if you're 5 years old, you're jolting that entire spine. Everything you've ever done lives somewhere in your spine. Yeah. Chris, you're fairly new.
Yeah, and the same thing happened to me. Pain made me actually do something about it.
And your cousin sent you, right?
My cousin sent me, yeah. Because I had seen a chiropractor originally when I had a sharp pain and couldn't move, had to sit there and relax for a little while, and finally said, okay, it's time to do something about it. And, went until I felt better, and then said, okay, I can do this on my own, and stopped going. And till it happened again, and, I came back, and it's been great, but it's really amazing how much of a change can happen in a short period of time. I think I've been here about 2 months now, and I had to leave work one day just because every 2 steps I would take, it would be such a sharp pain. I had to stop, and it's like, I work sheet metal, so I really can't be doing that, and trying to stop every 2 seconds. The boss wouldn't be happy, but I realized, I had to do something about it, because I'm the only one who cares about my health. So
Exactly. The
Do you happen to remember what you
responsibility.
said to me when we had our consultation with you the first day?
no, what did I?
I just remember saying that if we find that it's something that we can help you with, we can accept you for care.